So when it comes to revisions of implants, I've basically stopped. I basically have 3 surgeries that I do: breast augmentation, breast lift, tummy tuck. And I'm busy enough with those things that that's where all of my focus is. So when people have breast implants that need revision, I help them find another doctor. For revision of breast lift, so the classic would be, I had a breast lift, let's just say 5-10 years ago. There's something that's, they have something that's bugging them. And usually it's that the fold has given way and the breast tissue has fallen and that they don't have the braless look that they had. And so for me, it's all about figuring out, one, where is their nipple? And usually like I said, it's in the correct location. There's nothing to do there. The question is just, how do we tighten and reconstruct and strengthen the bottom? And so it ends up being an anchor breast lift minus the circle part. It's the vertical and the horizontal. So it's me redoing that and then adding layers 1, 2, 3 to the horizontal, and essentially just retucking and lifting the bottom and driving the breast tissue up. And then maybe I would fat graft them. That's a way to give volume to the cleavage and to the top. But that's the revision breast lift surgery for me. But I'll tell you, I don't get a ton of inquiries for it. And I will tell you that I think that's because most people are really happy with a quote unquote good breast lift. It really depends. We want to, if someone has a place where they have extra that they don't like, that would be a top spot. But if they don't have, or they don't have a specific area they want it to come from, places I look: lower abdomen, inner thigh, inner knee, places that I can get to while they're tummy up, so not having to flip them over. Usually I can get enough from those places. Every plastic surgeon would probably quote a different number on this, but yes, some of the fat goes away. I think traditionally that number would be as low as maybe, imagine half of it going away, 60% of it going away. Many surgeons would claim that they get much higher rates of fat sticking around by whatever technique they use. However, there's a product that was introduced to the market a few years ago, which is essentially washing the fat. And by washing the fat with a certain soap, basically, a surfactant, it allows the take rates to go to 80+%. So every time I fat graft, I'm using that. So all fat is washed. And so the take rate should be what the research shows, which is more than 80%. So the answer is yes. A breast lift always resizes the areola. So the areola, the pigmented part around the breast, I would say that most people are having a breast lift, their areola is larger than they want it to be. Specifically referring to the papule, which is the part of the nipple that the projecting part of the nipple, and that can be resized also. So everybody has a different technique for that. The technique I use is one popularized by a plastic surgeon in Texas. And it's essentially an amputation, basically, determining what part of the nipple you want to keep, of course, what part needs to go away, and then transecting that. And one of the reasons that he popularized it, or that the Texas doctor was such a fan of it, is that it preserves the ducts. So someone could still breastfeed, and it preserves the sensation because then the nerve endings are all still there. And it takes about 2 weeks for essentially the scab to heal. And so that's the one I use. Yeah, resizing a papule can be done, or, resizing a nipple can be done during an augmentation, during a lift. Not a ton, honestly. Breast anatomy is so different. Everybody has a different nipple size. Some people have basically nipples that are flat, and then nipples that are very projecting, but like everything, it's only what bothers the person. So how often does somebody bring it up to me? Maybe twice a year. And it's not something I point out, of course, but sometimes you'll hear, somebody's on a second, third, fourth consult with me, and they'll say, I had a bad experience with Dr. So-and-so. They went around and just pointed out, just went through my body and pointed out all the things that they think I should have done. And obviously not a great experience. Something comes through in the audio that I do, the videos that I make, that allows people to feel comfortable talking about this. I don't know exactly how I give people that perception, but there's some way that when people come in, they essentially already feel comfortable talking to me about these very sensitive, all of this is sensitive,